Hello, everyone. Good afternoon. Welcome to the Personal Statement for Medical School workshop. We are going to give 1 or 2 minutes before more people are coming into the room right now. But if you could please start writing in the questions box if you are at NIH or the name of your institution, and if you can also add where you are located at this moment. If you are in Bethesda, if you are in another place, it would be nice to see where you are. In the meantime, we wait for some people. So I'm seeing people from Bethesda. That's very nice. NIH Bethesda. A lot of people are here. That's great. Let me see if I can see more here. So very nice. Most of you are from NIH. That's good to know. We have some resources that are going to be for NIHers and some other resources for everyone. So it's nice to have this sense. Nice from Janilia. Nice. I love that place. Not from NIH, but welcome to NIDA, Illinois. Very nice. South Wayne State University, NIDA. Great. Is there supposed to be sound? Yes. Let me, if you can answer that, please. Everybody else can hear me, right? Because you are answering the question. So I guess that may be an issue from their end. Thank you. Thank you for letting me know that you can hear me. Yes, so maybe some other people from the staff can help me just respond to that question. They are supposed to be hearing now. Right, so a couple of people cannot hear. Miami, very nice, fantastic. So we have, great, fantastic. Now everybody can hear. So welcome everyone. I see people from all around. That's exciting. That's very nice. And that's the silver lining we have these days, right? We can reach out to more people in more places. So my name is Elena Hernandez Ramon. I'm the director of the pre-medical program at the Office of Intramural Training and Education. I am a pre-medical advisor. And I'd like to introduce 1 or 2 members of our team today. Dr. Kristen Zukowski, are you there?
Hi, welcome. I'm going to be answering some questions in the Q&A box.
Thank you very much. That's always very, very helpful. Hey, some people are saying hi, Dr. D. I don't know if Dr. Claiborne is there or Dr. Thibault or anybody else from the office, always helping us with when we have these big seminars. Okay, so let's start very briefly with a poll. Let me just see the audience we have today, and maybe that's going to help us a little bit. So let me just launch it here. If you can see the questions, please let me know if you're a trainee at NIH, other institutions, if you're an advisor, other staff member, or if you belong just to the other category, which is always long, but we have with everything in other. Great, fantastic. So we have the most majority of you are from NIH. So far, 74%, 15% from other institutions. Some advisors, welcome advisors and or staff members, and then other groups here. And most of you have voted by now, so I think we have a very clear idea. Let me see if I can. Can you see the results of the poll? Okay, you cannot see it, so let me see if I can just show that to you. I don't think you are seeing that. Okay, close. I think this is what I need to do. Can you see it now? Okay, great. So yeah, welcome everyone, people from NIH and outside NIH and everybody else. So let me start sharing with you what is the plan for today's presentation. And I'm gonna hide my camera because I know it's gonna work better that way, and then I'll go back and I'll try to see you, okay? So in this presentation, we are planning to cover what is a personal statement? What are medical schools looking for? I'm going to introduce the online personal statement preparation course that we have here at NIH. I know that some of you don't have this access, but still the material is going to be covered today. And I'm going to give you some information about the differences we have in the course. It's basically a little bit more, slow pace, step-by-step information. We're like taking your hand from step one to step two, but it's basically the information we have today. So for the NIH people who decides to go through the course, we are going to guarantee a spot at the end to review your personal statement. That's only for people at the NIH, and I have options for other people in other places. So we're going to cover something that we call collecting your experiences, how to select the content you want for this statement, some things that you should avoid, how to design your paragraphs. And we have some recordings from admissions that we have seen have been very helpful, very powerful for you to hear directly from admissions what they want to say about the personal statement. Okay, so we already passed the poll because we wanted to do that before. So let's start with a comment I heard from Dr. Gizara from the UMD, University of Maryland admissions. So she said that a good personal statement will not get you in if you don't have a strong application, right? So you cannot just rely on your personal statement. But that can certainly ruin your application, even if it's very competitive. And I can give you some examples of some people who have presented very, very strong applications, and then they don't have a good personal statement, or I would say even more than that, they have a bad personal statement, and they have issues getting interview invitations. So this is a very important piece of your application. And as I was showing in the previous slide, you have different plates, right? Different things to do for this application. Your stats are important, your experience is important, clinical, non-clinical, your leadership, so many important aspects, right? One other piece that is also very, very important is how you put together that personal statement. So according to the AMCAS manual, uh, the objective, the goal is to express here why you have selected the field of medicine, why you want to become a physician, right? That is the main thing. That is the main goal of this essay. Some of the things you can use to support that is how you have explored this path, how you have developed other skills that will be useful as a future medical school student and physician, right? What motivates you to learn more about medicine, and also other things that haven't been disclosed in other parts of your application that you want to show here. Additionally, you can, right? Additionally, as an optional thing, to share hardships and challenges. I encourage my students to share challenges because that's an important um, part of your story, and you learn a lot when you have challenges and you overcome them. So I encourage people to share that. And sometimes it's necessary to share some other things like significant fluctuations in your grades. Sometimes you had, a personal thing going on during that semester, and you are just showing low grades there. So it is important to let them know what happened, right? Especially if it was like a very clear specific factor at that point. All right. And I'm seeing a question here. Yes, this is going to be recorded and you can access it with the same link that you use for registration. So you are covered. Also, the slides are already in the handouts, so you can download them now. Or I know that someone from our staff is going to send you the slides probably tomorrow. So you have these two options. Okay. So in other words, what is this to say about? Why do you want to be a physician? That is the question that you need to answer. You don't have a lot of room to do this. You have 5,300 characters, and honestly, it sounds like a lot, but it is not. It's at the most one page and a half with single space, and you usually need to be very succinct to answer this question. So make sure that you don't deviate from this requirement from this mandate. You need to answer this question, right? For some of you, other aspects in your life have been very important. For some of you are sports or artistic endeavors, your dancing, your basketball, or your leadership role in this project or company. Those are great things to share, but that is not the topic or the main topic of this essay. You need to make sure that you answer the question why you want to be a physician, and of course you can share some of these experiences and connect those with medicine and be very clear about how those experiences have helped you develop skills that will be useful in the future for this career. Okay, so let me introduce the online personal statement prep course that we have at NIH. Again, for the people who are not at NIH, we're going to cover most of the materials today. We offer 10 modules there. We start with an introduction that actually I already covered part of the introduction we give in the course. And then we start with an article that I am hyperlinking here, so you have access to this article. This is from the Student Network, which sometimes we don't agree with some of the information there, but this article is really great. I strongly recommend people to read this. This is very helpful. And we also have a blog with a short article about how to work on personal statements and persuasive personal statements specifically. So if you can see this, if people at the NIH are going to have that as a requirement, as an assignment in the personal statement course, for people outside the NIH, you are going to have the slides and you can access them directly. So we're going to talk about how you brainstorm and start considering what experiences you may have had in the past that are going to be helpful to share, right? So we will talk in more detail about how to collect these experiences. We call it collecting. And then how to select the material, the experiences you want to put there on your personal statement. We'll talk about how to design your paragraphs, the importance of the first paragraph, creating and editing your first draft. For MD, PhD candidates, we have a couple of presentations, and I'm going to talk about those here too. About how do you describe your personal statement for MD, PhD candidates, your MD, PhD essay, and your research essay, and some details about VO schools, because for the most part, there are a lot of similarities, but we also have some differences, and we need to talk about those in your statement. So from this part, all this content we're going to cover today, and then we are going to ask in the course people to get feedback. For people outside NIH, we're going to ask you to ask feedback from colleagues, from PIs, from professors, so you can have at least other two pair of eyes looking at this. And when you have a final draft, we strongly recommend you to bring that draft to a pre-med advisor. Remember, a pre-med advisor hears from the association we have among advisors and from admissions, right? So the perspective is a little bit more general than even someone who went through the process and was accepted in a medical school. The scope, the experience is more narrow in terms of what you know about the many schools, right? Not just one school, but several schools. So I strongly recommend people to bring the final draft to the pre-med advisor. I recommend that order. First, the other people, PIs and other professors, and then coming to the advisor, okay? So let's analyze this step by step. Let's start with collecting these experiences. So we have this module with the idea of covering why you want to be a physician, right? And you need to start thinking about these experiences. How have you tested your interest? How you have prepared for medical school, right? Those are the three things we ask people to think about and to start writing and collecting somewhere. I heard a talk, and I need to give the credit to the University of Minneapolis many years ago about putting all these in a shoebox I just love the model to have a box. If you want to use an actual box, that would be fantastic. If you want to use something um, different, like an electronic file, folder or anything like that, just a place when you know that you are collecting, you are putting there all the experiences that you think have been important to make this decision, right? That will be very helpful because you're going to have a variety of things there that you're going to be able to classify, to group, and then to express why this has been important for you to make this decision. So this is just a matter of brainstorming why you want to be a physician, how you have tested your interests, and how you have prepared. And this is going to help you to create what we call the backbone, right? All these very specific, important categories that you are going to help you explain why you want to be a doctor, how much you know about the medical profession, and how you have tested your interest and prepared. Now, sometimes I have questions about well, these are the same questions. How I'm going to make this unique? This is personal, right? So even that it looks like it's going to be very similar, it is actually not. It is very specific because the reasons you are going to give here are through your personal experiences, right? And every personal statement should be unique. Even the same patient, even the same experience coming from two different people, you can see different angles there, right? So it is important to remember this is your personal experience. Questions can look like the same, but your actual reasons, what you observe, what you identify that got your attention from that shadowing, from that clinical volunteering, that is going to be unique. Now, let's start with how you started getting interested in this field. Okay, so before going there, I know this is such a different format that we have used in the past, right? We usually have this in person. I can see everyone, and I am a people person, and I want to see faces, and now we cannot do that. But still, I'd like to stop and ask if you have questions because I think it's just much better to have this a little bit more interactive than me talking, talking, talking. Okay? So, Kristen, have you seen any questions you think I should answer now? I know that some are just about, registration for the course, and I'm sure that has been already covered. Anything you think it's important to cover now?
No, I don't think so, except someone asked about the application for dental school.
Okay, thank you. That's a very good point. So I am going to say medical school, but actually is something very, very similar for dental school. You need to talk about what you observed when you shadow dentists, right? What what are they doing? What is the impact they are having on those patients too? So it is all the time. You can translate this to the dental school. It is very similar. I'm gonna highlight a few points later, some of the differences, but in general, your observations, your interaction with patients is gonna be very similar. Okay, thank you. Mm, okay, I am seeing a question about the themes, and I wanna make a comment here. Some people say this is very confusing. What is your theme, right? So my theme, and some people start, I'm gonna highlight leadership. I'm gonna highlight my dancing. I'm gonna highlight other things. Your theme is why you wanna be a doctor. Don't get confused with other things. The other things you may want to share, your previous experience, can help identify who you are and how you have developed some skills, but your theme is still why you want to be a doctor. I have seen many times people that say, oh, I am thinking about my theme. My theme is going to be dancing, but you are not applying to a dancing school, right? So you always need to focus on the main question, why you want to be a doctor. Okay, and I'm gonna give some examples later, but thank you for the question. Yes, your theme is why you want to be a doctor. Please don't deviate from there. Okay? Okay, so I think I can go ahead and continue because I am seeing questions about MD PhD and we're going to talk about that. And then we're going to talk about bad experiences too. And crafting the unique team is going to be, again, based on your unique experiences. Okay. Now, I just had a conversation this morning with Dean of Admissions, Associate Dean of Admissions from the Ohio University, the Ohio State University, College of Medicine. And she was reminding me how important it is to know who you are and your background in your personal statement, right? They want to learn who you are. So that's another important thing that you want to include. And of course, that's the same thing because that story, that part of the story of who you are, I'm sure is being shaping you to make this decision today, right? About becoming a physician. So that's another important point. Okay, so I think we can go ahead. I'm not sure if I'm reading all the questions, but if you have any question, Kristen, you think it's important, just let me know and I can just stop and answer, okay? Okay, more than one reason, absolutely. More than one reason, many reasons, right? And this is what we're going to explain different categories that you can use. Okay, so let's go ahead. Let me just stop my camera and let's talk about your reasons. How this story began, right? For some of you, everything started with an epiphany, what we call the epiphany. One experience that just happened and you were like thinking about other things and that was just like, what? This is probably something that is impacting me. I am thinking medicine may be for me. For some people, this happened when you were very young. Some people say, well, I have this person, in my high school telling me about medicine, or we were reviewing this uh, neuroscience based article and we were learning about the brain and I thought, oh my gosh, this is so interesting, right? Or some of you had experience, let me remember some statements. Some people were reading a book or watching a movie or watching a documentary and it was so interesting that you got this initial sudden motivation, right? Is that something that you want to mention? And I think Mika is asking, should we talk about that? Well, we think that if that was something that struck you, you can start with that, but definitely it has to be very brief because in most of the times that happened when you were very young and you want to move on and just express what you have done to learn more about the medical field, right? So it may be valid. Some people skip it if they feel that that is not very important. Some people want to share that epiphany, that moment, but then make sure you move on quickly. That is going to be only a mention, right? Other reasons why you want to become a physician when you have a sick relative. And in some cases, when you have been sick, I've also seen students who have been sick in the past. So I think it is okay. I think it is important to show this part of your life, having a parent, a sister, a relative, or yourself sick, and how, as a patient, you saw medicine from a different perspective. So it is valid, but again, needs to be brief, needs to focus on the doctors, and that is a different thing, a difficult thing when your relative is the patient, right? Sometimes we give the example that when you see the orthopedic surgeon reducing a fracture and you are just shadowing, you can say, oh, that was super cool, right? It was like fixed at the moment, and then they did this and did that. But if that is your brother, if that is yourself, if that is your mother, your angle is different, right? You are thinking about the patient. So your perspective as a patient or as a patient's relative is going to be very different than if you are just shadowing. So our recommendation is that if you want to share that, you share that briefly. You don't expand on that. They may get interested in knowing how your story started, but you're not going to spend a lot of time, right? Some people have had bad experiences. And of course, I understand that sometimes we want to share that. Um, However, in general, psychology says that if you show yourself as a positive person, if you show the kind of doctor you want to be instead of the kind of doctor you don't want to be, the outcome is more successful, is more positive, right? Um, and especially in the second example, when you say, well, this was malpractice, this was not fair, etc., you are not saying, and this is what I observed that was good. I mean, you can include that, but in that experience, the only thing you're saying is that you observed something negative. So consider that. Uh, as always, there are exceptions. As always, it's very important the language and the perspective you use. But you, in general, want to be positive. You don't want to be the negative person, right? And then, so in summary, you can use it as something that sparks your interest, but you move on. Why you move on so quickly? Because you didn't choose to have this sick relative, right? That was not your initiative. That happened to you, unfortunately. That helped you consider medicine. But then the important thing is what you did to learn more about the medical profession. You decided to shadow, you decided to go to that hospital and volunteer. You decided to also help your community in many other aspects. So that is going to be more much weight. It was your initiative. You are older, you are more mature. So those aspects are going to have more weight. Okay? Great. Sometimes you have experience or you have observed um, health inequities. You have observed that we need this different healthcare, increased healthcare or better healthcare in some areas. Of course, that can also pique your interest, right? And again, you see that that can just spark your interest, and then let's show what you did to learn more about this. For some of you, this has been less specific. It's been more like a gradual process, right? You were a curious kid. You were very interested in science. You started getting more exposure to science. You have a passion for learning, and you are also a compassionate person and an empathic person. And then, among other options, you thought that medicine could be one. And hopefully you decided to explore medicine, the medical field, and other fields, right? There is nothing wrong with this. Many times I have students in my office saying, well, I don't have a relative who is sick. I don't have the epiphany. Uh, I'm sorry, but I don't have this. What can I do, right? So there is nothing wrong with that. Actually, I have heard some admissions saying, if this was a process, if you were actually testing other interests, that's totally fine, right? So think about this. If this is your case, just tell them your story, right? How a curious person you were, how you got interested in that science class. I have people who said, we were studying the nervous system and then the normal brain and the pathology of the brain, the neurological disorders. And I was very intrigued. I wanted to learn more. I wanted to see what happens when this system works and what if the system doesn't work and how I can fix it, right? So that is also totally fine. So your passion for learning and also this other side, the compassion and the empathy. Okay. So any of these four, and maybe I'm missing some other reasons why, those could be happening early in your life that may have just sparked your interest. But then the possibility crossed your mind. You said, maybe this is good for me. Maybe this is a good fit. Then what did you do? And that is one of the most important parts of the process, right? What did you do? So I hope you had the chance to explore the medical field, shadowing doctors, volunteering in clinical settings, in hospitals, in clinics, other clinical experiences. Some of you have worked actually in the medical field, scribing as EMTs, not studying, working abroad or volunteering abroad in the medical field. So this is going to be super important because you are going to show that you decided to explore, to learn more about the medical career, and that you learn about this, right? During these experiences, you will observe what doctors do. You can identify what parts of this profession excited you, got your attention, and you may remember some specific things doctor did. So for this, I'm gonna go to my second poll, and this is about, forget about what I just said. Think about when you were planning about your personal statement, or if you have already written it, what is the theme, if we can call it the theme, or the most important thing you plan to write about? So if I go to my second poll, I'm giving you some options here. Let me go to this one. So I put compassion. Can you see it now?
Yes.
Okay, good. So compassion, active listening, help problem solving, research, right? So what is what you want to talk about, like the most important thing you want to highlight? I'd like to know what is your plan now. We have a lot of people from the NIH and other people in other places, so for me it would be very, very important to see where do you want to put your focus on. Okay, so far 75 have voted. Please vote. Compassion 33%, health problem solving 26%, research 28%. So research is having here seen the winner here. Other things 7%, active listening only 7%. Okay, good. I think we have a good number of people participated so far. So let me close here and show it to you. You can see the results, right? So research 27%, health problem solving 26%. Sorry, compassion is the first one. I got it wrong. 33% compassion, focusing on your personal statement on compassion. 27 on research, 26 in health problem solving. The most important ones that I am seeing here. Okay, so
Lynn,
that,
sorry, there's a question. What do you mean by health problem solving?
thank you for the question. So let's say you have, let me put a couple of examples. You have a broken leg in the emergency room when you are observing. You are talking about doctors, or you want to focus on how that problem was fixed or was solved, or how kind how compassionate the doctor was in that emergency room, right? Other example, because that's like very problem fixing clear. But what about a diabetic person, right? You don't cure the person, you treat the patient, you manage, you control the disease, right? So do you focus on how compassionate the doctor was, how this doctor managed the treatment, or the research background this person had, right? I hope that clarifies. Okay, so you are seeing the poll now, and the winner is compassion, and actually that is what we see. I would say from the personal statements I read, I think compassion may be probably 50%. Okay, so let's pause here. Let me go ahead to the next slides, and I'm gonna come back to this. Okay. I am seeing health disparities in the questions, or health inequities. Yes, I think that may be slightly different. However, you can always go and focus on those health issues that need to be solved or improved, right? So I think part of that, I would put them in the health problem solving. Anyway, we can have this discussion a bit later. So this is what I see. Exactly what you said. Many people use compassion, kindness, and empathy as the main thing, and they forget to include the problem-solving aspect of medicine. That doesn't need to be curing people, but improving health. So something I always try to remind people is, what is your final goal as a physician? What is your final goal? So let me show this chart here, which I think highlights important aspects. So you want to improve health, right? But you're not just a fixer. Of course, you want to develop trust. You want to have some listening skills. You want to be kind. You want to be empathic, right? Why is that important? Because you need to know that information. You need to be the person your patients trust to tell you exactly what they are feeling, right? What they are doing, how they are eating, how they are taking the medicine, right? All this information is going to be very helpful for you to diagnose and treat your patient. So at the end of the day, you can improve their health. In some cases, it's going to be like the orthopedic surgeon, you're going to be able to fix a leg. In other cases, you're going to be able to manage this diabetic person. So let me put two examples here. The diabetic patient who doesn't know who is diabetic comes to the doctor's office and starts saying, I have these issues, but some of the issues are a little bit embarrassing to share. So the doctor needs to develop this trust, right? Tell me about that. Being open, being not judgmental, everything that it's important to be approachable, to show your empathy. So the patient trusts the doctor and start sharing all this information. And the patient shared that he's been losing weight, she doesn't have energy to play with the kids, she is not able to work in that factory, doesn't have the energy to work. So that information together with lab work, together with imaging results, together with a lot of things that also some other health professionals and are part of the medical team are going to have the input, the information. The doctor as the leader of the team is going to put together all this information, right? What the patient says, what he explores with the patient and other extra information. And then is able to diagnose and treat the patient. Of course, he needs to be culturally competent, right? Because if he doesn't know what is, just to put an example, as a Hispanic patient, how important is including carbs in the diet or not, right? So there are a lot of factors this doctor needs to put together, but at the end of the day, he or she needs to establish a plan to improve health. So as you can see, the number one, the compassion, the listening, the kindness, is very important. It's number one. But we cannot forget what is our final goal. Are you developing trust and being kind and showing empathy because you're a nice person, or you want to show that you are a nice person? Are you doing this because you want to be your patient's friend? Or this is just a part of the whole process that includes this very important first step in order to diagnose and treat and finally improve your patient's health. So I invite you to reflect on this because many of my statements are about compassion and empathy, and they don't go beyond what is the purpose of that kindness, right? And then when I read that statement, I try to analyze. This is always a question I have myself at the end of reading that statement. Is this going to be helpful or, sorry, useful or um, good for another application like nursing school, like social work? Sometimes, like almost everything, empathy and listening is important. Developing trust is important for many careers. So you really need to make this more uh, doctors unique oriented. And that for that, you need to remember that your goal is to improve the health of your patient, right? So I really would like you to may consider the importance of compassion and your final goal as a physician. Okay, I'm gonna stop here because I would like to see if there are other questions about it, about this. I think this part is one of the most important ones from this workshop. You need to remember your goal. If you are writing a personal statement saying that you want to be kind, you can be a fantastic doctor and you can be a fantastic 100 other things. You are not saying why you want to be a physician. Okay. So, are there any questions so far? Thank you
Um,
for the
a,
comments. Yes.
a couple of questions just about like being specific, what types of examples you should include, and what about research? So I don't know how much you're going to be talking about research in a
Oh,
bit.
we're going to talk about research. Of course, we love research here, right? Yes, and that is super important. Let me just finish with the clinical and we'll get to the research. Examples as the example I gave you. So let me just finish that example because I think I didn't finish it. So this person I was telling you comes to the office very tired, very exhausted, losing weight, losing all the motivation for everything, family, job, etc. Right? So you gather the information, you diagnose and treat. So you observe the doctor, that good doctor that you admire, that is inspiring you, that can connect with the patient. The patient can say, yes, I eat a box of chocolates every day because I have the carving, and then you start, putting together all the information, right? And then you see that the doctor diagnosed and treats. And then after a couple of months, you see the patient coming back like a total different person, right? This lady now have the energy to go to work, is functional in the society, has the energy to play with her kids, has the energy to cook, to function in every setting that is important for her, right? So this doctor is making a huge impact in that patient's life. We didn't cure, in this particular case, we didn't cure the diabetes, right? But we manage it because this person is now receiving a treatment, and this treatment, it can be very comprehensive, right? Not only pills but also diet advice, also exercise, also other things, right? So you need to put together a good plan so your patient is improving her health, and therefore her life is going to be totally different. The impact doctors have on the society is huge. We are living now in a crisis health, and I'm sure you have seen that, right? So this is just an example of something you can say according to your experience, right? Some people talk about things like, I was in the emergency room, this person was dying, and then the doctors intervened, and now the person is alive. That is the impact doctors have. Now, I was forgetting one example I really wanted to show today. Imagine you have three doctors. You have intense pain, very hard pain, and looks like you have appendicitis. And the appendicitis is about to explode. And you have three doctors and you need to choose one from them. The first doctor is super nice, super kind, compassionate. Everything is a candy. You love him, right? But he doesn't know the surgical procedure, right? You have a second doctor who doesn't have like any kind of, empathy, or is not very compassionate, but he, explore you and he knows that you have appendicitis and you need this urgent surgery, right? But he's like not very kind, very nice. And you have a third doctor who is very kind, compassionate, and knows the procedure. So if I ask you what doctor you want to see, I'm sure you're gonna say the third one, right? Nice person who knows the procedure. But what about the other two? What doctor would you choose if those are the only two in that emergency room? You want to choose the kind one, or you're going to choose the second? And I am seeing in the chat the second, right? So it is important for you to think about this. Medicine has a very important component that is problem solving. Of course, you don't want to be the cold doctor. You don't want to be the not compassionate and unkind doctor. Of course not. But with kindness, you don't make the difference. Kindness is step number one. There are other steps you need to go through. And I think that's very, very important to remind you about. Okay? Good. Okay. So let's move forward. Any other questions? Are we good so far?
There were a couple of questions just about which themes they ultimately care about and what you should focus on.
So again, I'm gonna talk about other things because we have like half of the presentation left. We can talk about other things, but just remember, things are important things according to your experience that are gonna support why you want to be a physician. And I think after talking about the clinical, we're gonna have this more clear. Let me go ahead and I'm gonna ask this question again at the end and see if it's more clear now. Okay, so other thing you can witness as a volunteer or when you are shadowing physicians are challenges, right? If you have shadowed and volunteer, you know that dealing with sick people is not easy, right? If you are going to the pediatric ward, if you need to play with sick people, with sick kids, you will see that it's just so different than when you are actually playing with kids for your community service, with healthy individuals, right? Just the environment is challenging. And you need to show that you are aware of that and you're still happy going to that environment, right? Um, when you interact with people, with patients, having this direct contact and knowing that they are going through difficult situations and still you have the patience and you can deal with them, you can talk to them, you can support them, that's very valuable because you know that that is challenging, right? You have worked long hours also as a volunteer and you know that sometimes you're very tired, you are exhausted and you still need to be kind to your patients, right? So all these things showing the challenges you learn may be also important to include, okay? Sometimes doctors you shadow are not very successful in that treatment plan or the patients die or things like that that are also challenging. Not everything is going to be successful, right? And if you have shadowed enough and having enough clinical volunteering, you will see that even that we wish that that never happened, it happens sometimes, even with the best physician. So sharing those challenges is also important. Okay. All right. So including these experiences when you have been providing direct patient care, you don't have to be a physician. They are not expecting you to treat patients, but just interacting with the patients, right? And the skills we were talking about with in these challenging situations, the skills you have developed with those patients, right? What kind of patient populations you have been serving, the settings, um, what have you learned, for example, if you are doing clinical research? And I'm focusing only on the clinical aspect now. We're going to talk about research in a second, okay? So all the clinical exposure is super important. You cannot miss this part in your personal statement. You have explored, hopefully everyone has, shadowing experiences in clinical volunteering, and some of you have clinical jobs. You need to talk about this. This is a must. You need to show them your exploration and your preparation to this field. Now, there are other things that are important. And see the way I am telling you this, right? That is essential. There are other things that you can also include. What are those? Some other community service you have provided, some other skills that you have developed, for example, when you teach, when you work with animals, when you work with the community. This is also important. So you can also share that. But we're going to talk about proportion in a second, right? You cannot talk about your animal shelter for the whole essay and then at the end say a little bit about your shadowing physicians because then you are not giving the proportion to the things you should. Okay? Just as a reminder, I am putting here the competencies that the AAMC recommend for entering medical students. Just to remember that in many of the things you do, that could be doing your job or your research or other things, you develop skills. So I'm not going to go through the skills. This is just a reminder of the skills you develop. Cultural competence, people from different backgrounds, for example, with, for example, people which parents were born in a different country, you know how important it is to have these cultural factors taken into consideration when you think about treatments, right? And you have that teamwork when you have these different jobs, etc. So make sure that you review the competencies again, and you identify the skills you have developed. You don't need to put every single skill, right? You need to select your critical thinking, your science competencies, etc. I'm not going to read them. Okay, research, and I know this is one of the most favorite topics today. Any questions so far before going to research?
No, I think you're good.
Hmm. Sounds good. Sorry, I'm drinking some water. Okay, your research is very important. It's going to be the cherry on the cake. Well, we know that it's more than the cherry on the cake. Most of schools almost require research in the experiences for their candidates because they know that medicine advances through research and they want you to have that information and that experience, right? What I have seen at the NIH, I need to say, is that sometimes the research is the cake and not the cherry on the cake. So you spend a lot of time, and if you go back to our poll, research was in the 27%, was the second one from the list. Of course, research is super important, but many people at the NIH spend many characters with so many details about the research that you you don't get lost, but you can lose your reader with so many details without showing the big picture on the application immediately, right? In that short paragraph that you, of course, I strongly recommend you to talk about your research, but the importance here is what angle are you taking to talk about this? Do you want to expand on that sophisticated technique that almost nobody masters, and you master that technique and you are so proud that you focus on that technique and you forget about what is the point of bringing this topic to the statement? So your angle should be how through your experience, your research experience, medicine advances. How can medicine advance? Better prevention, better diagnosis or early diagnosis, better treatment, better prognosis. That is usually the way you can explain your research, right? You need to be very clear with the big picture and the application, because so many times I read statements including 2 paragraphs about research, and you get into the details of the transcription factor and the technique and the uh, small molecules and their receptors, and then we don't know what you were talking about. Research, I have a passion for research, as you can imagine, right? I got my MD first, and then I discovered research, and I married research for many, many years. And actually, I've abandoned a little bit the MD, but I still had the medical background and it was useful. But my point is, when you discover research, you love it. You want to talk about that. You get excited about your project. But our projects are so specific, so narrow, that when we get excited in the personal statement, we may lose the focus. We may lose the point. And I can forget about mentioning that my project was about better drugs to treat breast cancer without causing endometrial cancer. And I can just go to, I'm talking about my specific research, and I can just go to say how cool, how interesting was to identify adults, tamoxifen DNA adults with this beautiful technique I used. And then I get excited, I get into the detail, and I forget about what is the main point. I don't want people with breast cancer while receiving this treatment to then suffer endometrial cancer, right? And the word patients, when you are mentioning your research, is critical. How patients benefit from your research. So you need to step back a lot of steps to see the big picture and see how patients will benefit, and you need to include that in your personal statement. So yes, absolutely, research is super important. Please mention that. please mention your research, but be very careful with the angle you take, your perspective, and make sure you always mention patients, mention what kind of diseases you are going to help with, to prevent, to treat, and the whole application. Okay? Any questions about this? Oh, this is a very good question. Sorry, there are so many questions that the first one I see is the one I'm gonna read, but if there are other questions, please just let me know at this. And should we mention research if we are applying MD PhD and have two other statements to discuss research? Very, very good question. Please, yes, mention your research, but the angle you're gonna take here is gonna be the application, right? How research advances medicine, right? Or how medicine is advances through research. So that is going to be a different angle. And then when you have your research, your MD, PhD, and your research, you can go into more details in your research essay, and I'm going to talk about MD, PhD in a second. Okay? Great. Let me see, you're applying to MD programs. Will admission committees question why you are not applying to an MD PhD program if your personal statement focuses on research? Okay, so first thing, you are not gonna focus your personal statement on research. Your focus is gonna be your clinical. You're gonna mention research, and we're gonna talk about proportion in that statement, okay? So it is important to mention research, but you are not gonna focus on research. That first clarification, okay? And then, so if you go to MSAR, there is one graph that says experiences for the entering class, medical school, the first year class, and you will see the importance of research and other aspects in that school. And you will see how practically in every single school, research is like in 90-something%. So almost every single school cares about your research experience. So don't get shy or don't think that mentioning research is something bad. They are looking for finding your research experience. Okay.
Elena, a couple of questions about students who are doing basic research that may not directly impact the clinic.
Oh, that's a very good question. So I always say, even if you are doing research with zebrafish, you can always extrapolate that to the application. So most of the research is going to be helpful at some point, even with negative results, right? So you work with this gene in zebrafish, but this gene may be involved in development and maybe a gene that is actually very conserved among all these different species and actually in humans too, right? So you always need to have this big picture. Basic research is the foundation to better understanding mechanisms for things that will maybe applicable in 5 years, 10 years, sometimes even longer, but without that foundation, we cannot advance. So it is important to mention how you see your research being applicable in the future. You are not saying, I am curing cancer when I study this transcription factor, right? I am going to cure cancer. But I think it is very important to say this represents the foundation to understand better what is happening with patients with these kind of mutations in these different cancers, right? There is always a way to connect your research, even if it's basic, to the application. And you don't feel like, oh, I'm being like very ambitious, or I am not being honest about the impact of my research. What they want to see is your perspective, right? They are not expecting you to be the person who found this new therapy for Alzheimer's, right? They want you to have the perspective of, studying this gene that was one of 50 found overexpressed in these cells with patients with Alzheimer's can represent in the future a target for gene therapy, right? That can be. And if that is not the gene, Other people are going to work on other genes. Your goal is going to be to elucidate the mechanisms and to find target genes. You see what I mean? I hope that is clear.
Yes, thank you, Elena. And then there have been several questions also about specific fields, either students who already know sort of what specific field they want to go into and how much to highlight that, or the opposite, they're working in a research field that they don't ultimately want to study in medical school.
Okay, so if it's only MD programs, I would say specific fields like specific specialties. Remember that more than 50% of the people who enter medical school with one idea of a specialty change their minds. So don't be so close to options. I shadowed 3 pediatricians. I'm going to be a pediatrician, right? Don't be so narrow in your options. I would say it's nice to hear your exposure and what you like from those, shadowing experiences or research fields. So show your interest, show your experience, but also show your openness to learn new things, to explore other fields, and to just be open to be that pediatrician or other things that you still need to know. You haven't gone through medical school, remember, right? You have shadowed some physicians, but that is different than going to medical school. You're going to learn a lot. You're going to be exposed to so many fields that you're going to have much more options then. Okay? And then that was the only one, Kristen, or I am forgetting one?
That was great.
Okay.
And
Sounds good.
then
Yeah.
And then the second half was just, if you're studying something now in your research that you don't necessarily want to study in
Yes.
medical school.
Thank you. So as an MD candidate, I don't think they are expecting you to continue with that kind of research. The general skills you develop, your critical thinking, your analytical skills, that is going to be helpful, right? Those are transferable skills. So you don't need to explain that you don't want to do any kind of research as an MD. As an MD PhD, um, different things here. Many of the techniques and also the skills that you develop in one kind of research may be transferable. If you want to learn more about other things, just make sure that so how clear you can be about that. In the personal statement per se, you are explaining, you are saying why you want to be a physician, right? So probably here is not a place where you are going to share that you are planning to change your research field. You're going to have other two essays, the MD PhD and the research. I think those may be better places to explain what you have learned and also express your future interest. And why? Because usually for MD PhDs, many people want to continue or have clear what they want, but some of them want to explore other fields. Some of them choose schools that allow rotation so you can have more exposure to different research fields. And that's totally fine too, right? So you will have that chance and you will look for those schools when you select your schools. So I think it's going to be totally fine to say now I am considering, so an important thing here, I am considering this other field. Why? There are two ways to approach this, right? Running away from something or running towards something. So hopefully you take the second approach. And you don't say, well, you know what? I did immunology and I really didn't like it. Or while I was doing immunology, I started learning a little bit about computational research. And it's really getting my attention. So the second example is running towards something that got your interest, right? The first one is running away of immunology because it's too complex and boring, right? Which is not, but anyway, just an example. So make sure that when you are changing fields, you focus on running towards something instead of running away. Okay, I hope I answered that question. Let's go ahead. All right, so what we recommend students is to really reflect on these experiences, putting everything in your shoebox, right? Real or electronic. reflect about these experiences and how you relate those to your interest and desire to become a physician. If you had the epiphany, if you have family, community experience with health issues, if you have this curiosity, your passion for learning, your compassion, your empathy, everything that shows these things, put them together there. I recommend people to put only one or two sentences because once you start writing, some people don't want to change what they wrote. So I'd like you at this point to have like bullet points. Okay, and that's one approach. I'm not telling you like what is the truth about personal statement and the only way you can write it. This is one approach we recommend, but of course there are many ways to approach this. So we recommend that. And we would like you to do the same on the second question we have there, how you have tested your interest. And that is all about your clinical exposure, right? So we said, reflect on that shadowing, reflect on that clinical volunteering when you highlight the doctor's role, and hopefully you can remember those experiences, those stories when it was very clear the impact doctors had on patients' health, right? We go back again to the empathy and the compassion. We are not gonna just stop there. If you want to talk about compassion, you need to say what the doctor gained using that approach to improve health. Okay? So again, one or two sentences. For people in the course, you're going to have the explanation there. For people outside NIH, just write one or two sentences and we are going to go back to that long list of experiences. Okay? If you are shadowing now, if you are having the clinical experience now, which I know is challenging because we are at the middle of the pandemic still, but if you are doing that, or as soon as you can continue with that, please journal, take notes, put details about the cases you are seeing. Many times my students remember that was a very cool case, that was very impactful. And when I ask, okay, tell me what you observed, they just don't remember, right? I don't remember the approximate age of the patient. I don't remember the case. I don't remember the disease, but it was very cool. So we need some specifics there to show examples. Okay. And then the final thing, exactly the same, but this is about how you have prepared, and that's basically the non-clinical, your interaction with the community, teaching, other experiences, even jobs, leadership positions when you have developed skills, and how these experiences have prepared you for this profession. Okay? Good. I am seeing a question here about the virtual shadowing. So remember, we do what we can, right? If you can put together your conclusions about what you have learned from physicians, both in person and virtual, that would be great. So you don't rely only on the virtual opportunities. At this point, some people have shadowed in person for a certain time, and then they are complementing that experience with virtual opportunities. And I think that's totally fine. I'm sure you can learn things through the virtual option. And to be completely honest, we don't have many options at this point. I'm sure your admissions will value that. Probably a different case would be if you have only shadow virtually, because I think it's important to see that in person. However, I know it's been challenging, and you may just expand whenever you can beyond the virtual shadowing. Okay, let's move ahead. So the idea is to have a long list of all these three aspects, right? Your motivations, how you have tested, how have you prepared for this career, and put in there. And then the next section would be how to select what you want to share. Okay, so we would like you to actually think about some groups of experiences, of some categories, right? What is important for you? What relates to the field of medicine? What you use to prepare for this career? Maybe you have 10 experiences that prepare you, but there are going to be some that are going to be more important than others, right? For some, and this is very different from person to person. I have people who love teaching and they have developed a lot of communication skills, and they realize that when doctors communicate well with the patient understands better. They may stick better to the treatments, and the outcome is going to be much more successful. So if you are a person who loves teaching and communication in general, you can for sure use this aspect, these stories. And it doesn't have to be only that teaching for those elementary school kids. You can put in one paragraph why communication is important. And you can include in that paragraph what you did with how you developed the skills when you were teaching to that elementary school kids, but also when you were a TA, and also when you were presenting your work in different conferences, right? All that is communication. So if we go back to the themes, communication may be one theme that you use for one paragraph, and how you tie that to the medical field. Okay? Your selection is not going to be the experience you had with the elementary school kids. That is not the selection we are advising you to do. We are advising you to actually, now that you have all these experiences, you're going to mix them. You are going to change them from the list it was before, according to the experience, and then group them by more general things. And I think the communication is a very good one that shows how many experiences may be all shown in one paragraph. Some people have paragraphs about the motivation. That is usually very brief, but that could be one thing. Growing up and experiencing health inequities, that may be another part you want to include. And you can say that you experienced that when you were growing up, but also when you move from this place to this other place. And as a grown up, you also see that, right? So it doesn't have to be just one experience. Again, is a group of experiences, and you are going to talk about a specific theme in that paragraph, but it is, again, all related to medical school. So hopefully at the end of this paragraph about what you observe in health inequities, you can also say the importance of health and how this part of the society, this community, can have a different life, a different expectation, a different outcome if they have accessible healthcare, because they can probably the kids can learn better because the nutrition situation is different, and how this chain of things impact one another, and how health is one of the number one steps in a healthy person, is the foundation to be functional and successful in the society. Okay, so things like that by themes. So I am highlighting here in this list of examples my exposure to medicine, shadowing, volunteering at several hospitals, and as an EMT taught me about the medical field. So that may be one paragraph, hopefully one of the paragraphs that have more characters, right? Because you are explaining what you have learned, and you are explaining what you want to do in the future in terms of problem solving, in terms of improving health, right? So that is going to be one of the most important ones, but not the only one, right? We have here why you decided to do research, what kind, how is this going to be applied? Maybe in this paragraph about research, you want to talk about your undergrad research, or even how you started doing research in that high school summer internship, I don't know, together with how that evolved in your undergrad and how that culminated at the NIH. Doesn't matter if that is not chronological. What you are saying is you can identify the importance of research for medicine. How medicine, the only way medicine advances is through research, and you are going to have your specific topic, your specific research to explain that, right? So again, putting together different experiences to talk about research. And then recognizing physicians' leadership role, your experience as a leader to different other experiences, right? This is another example. So again, it's very important to put emphasis through proportion. This essay is not about leadership. So please don't talk about leadership in 2 or 3 paragraphs and talk about your exposure to medicine in one small paragraph. We want you to really highlight and emphasize your exposure to medicine and what you have learned from doctors and the medical environment. Okay? So remember, you already have 15 slots in your AMCAS. Those slots are isolated experiences. Your personal statement is the opportunity to put them together, to integrate them, right? So it's a series of experiences instead of just one, okay? Give examples, especially for the clinical, especially for the problem-solving aspect, please give examples of that. Because admissions also complain about not explaining specifically why you want to be a physician. So again, it must include your clinical exposure, be specific, share anecdotes and details, and again, put emphasis through proportion. Your clinical needs to have the emphasis. You need to highlight that section. And proportionally, that should be bigger. You need to expand on that. And don't sacrifice that because you want to include 10 things. So you have done 10 things or 15, or you want to put different themes, and then you sacrifice the characters you have in your clinical exposure, right? So we don't recommend you to do that. All right, so that is going to help you select your experiences. So that is the final assignment that we have in the course, and you can also do by yourselves, make the list of experiences according to different categories and different groups. Okay, so that will be in general the content. We're going to talk about first paragraph and last paragraph in a second, but before that, I like to go over general thoughts about how to design your paragraphs, right? There are different styles, but this is not a college essay. So in general, admissions don't like creative writing for this essay. It's important to know. I need to put a disclaimer here. We are trying to give advice, a general advice for more than 150 schools, and every school is going to be different, of course, but you only have one statement for all of them, right? So it is important to go for the most common advice we receive. And I say that because I heard someone once saying, well, I actually like creative writing. I think that's the only time I've heard that comment. In general, I've heard from many admissions, please don't use creative writing. We don't need it here. We read so many, we cannot pay attention to details that are not important for us to make this decision, right? It is, in general, a formal essay. We, in general, recommend chronological over priority. However, some people do that, the priority style, and that's also fine. Everything you mentioned should be relevant and related to the medical school application, right? Remember, it's medical school. So important, every time you write about whatever, something, you need to see how you're going to connect that. And you don't need to say, this is going to be connected to medicine. But if during that, swimming training or ballet lesson, you develop your discipline, you learn how to manage your time, etc., just make sure that you highlight those skills. And you can say sometimes, not in every paragraph, that is going to be very helpful for medical school, or you don't have to say, we all know that they will be helpful there, okay? There is a little bit of confusion about if your personal statement should be a story or not. What we have heard is that it is good to have a story there, but not a story that uses flowery language, not a story that starts with, it was a foggy morning when I was going to the hospital. Not that kind of story. Story in terms of taking the person through your journey step by step, right? Some people say, well, when I grew up, I witnessed this. This is part of my background, and this is important for me to make this decision. And after that, I learned this. And I didn't know about anything about research, but I had this exposure and I loved it. And when I was doing research, I realized how we can apply this to patients. And I want to be directly implementing this research in patients, blah, blah, blah. So this is a story without talking about the weather, right? So we think that telling your story is important. I think it's important to use good transitions, to analyze, to include the whys and not just bullet points, right? And the example I have here is the NIH. Many times when you want to talk about research at the NIH, you just start with, at NIH, I'm doing this kind of research. And I strongly recommend you to tell them why you decided to go to the NIH or to go to whatever place you are now in your gap year or doing a special thing in your research. Why? Because you were interested in the nervous system or in neurological disorders, because you wanted to see how medicine advances in this particular field, and because there is so much to know about the brain or the liver or whatever, right? You need to relate this to your research, but tell them why first. I was interested and then I decided to do this and that. Give concrete examples. Whenever you had a big achievement, this is usually a team achievement. So make sure that you give credit. Sometimes we see people that say, I discovered, I did this. And we have the two extremes, right? From people who said I did everything to people that says always we, even if things that they did by themselves. So try to find a good balance there. We don't have a lot of room, so you need to be succinct and try to avoid repeating or using words that you don't need, and make it easy. Don't make this complicated, right? Sometimes you have repetition, sometimes you make it jumpy, very jumpy in times, or you think leadership is important and you talk about leadership in the first and the second and the third paragraph, and then your readers may be lost. So one of the things we have noticed is that the first paragraph is always challenging. We receive different advice from different schools. I heard this morning slightly different advice from a person working in admissions. So I think it is important to go through the most common, to go by the most common advice we receive. And in general, I've heard, please, no hooks, no catchy introductions. Has to be brief, has to be more oriented to how you became interested in the profession. Sometimes a personal story, sometimes something related to one of your interests. That could be music, could be swimming, how you relate that to medicine, and that's it, right? Avoid too much drama, avoid too funny, because this is formal, right? Try to avoid scenarios and quotes like it was a sunny and warm day, or a foggy afternoon, or a cold winter morning, whatever, right? Avoid things that are very dramatic, like I have seen several of these. The woman was covered in blood when she entered the emergency room, right? We don't want to start a statement like that. Avoid quotes. Life's most persistent and urgent question is blah, blah, blah. But that could be very nice, but that is not yours. So just make sure that this is your personal statement. I have to say, I have seen quotes sometimes that are nice. It depends on the context. Make sure that if you are strongly convinced that you need that quote, bring it to your advisor and we can take a look. Any questions so far? And I need a pause to drink some water.
Elena, there have been a couple of questions that you alluded to a little bit about the overlap with the activities section, especially the overlap with the most meaningful. So you alluded to it a little bit talking about the analysis and the why, but can you talk a little bit more about that?
Sure. So I think I had a slide, but yes, happy to do it now. Your essay is why you want to be a physician, right? And the indication for your most meaningful experiences is that you choose something that was meaningful to make this decision. So, for the most part, what I am hearing from admissions is you want to be consistent. They expect some overlap. they don't expect a copied and pasted section, right? You don't want to do that. As we said before, we recommend this to work more as categories, as group of experiences instead of one experience. So some overlap is expected, right? Just because you need to show consistency, you chose those experiences because they were very meaningful for you to become a physician. And this is why you want to be a physician. Yes, needs to be some overlap. Just make sure you don't copy and paste. Make sure you integrate more than one experience per paragraph, not just one, right? To make this kind of theme stronger. Let's say in your experience, in your slots, you have one summer doing research and your research at the NIH, right? You want to include one paragraph about research in your personal statement. That's going to have both, right? You're not going to talk about one or the other. So it's going to be some overlap, yes, because you are again talking about the NIH, but not only the NIH. You may have other ways to explain why research was important for you. I hope that explains that. Any other question?
There's a question just about vocabulary. How simple or academic should the vocabulary be in the personal statement?
Okay, so I have some slides with some examples, some words you should avoid, some shorts you may want to use, strong verbs. I think this is always professional and formal, right? So you don't try not to use slang, try not to use obviously unprofessional words. Um, how sophisticated you want this? I think there is a limit, right? I have read some statements with words that I'm sure they were taken from the thesaurus because maybe they were repeating another word so many times, and it is a word that nobody uses, right? So you don't want to fall in the stream of this is super sophisticated and complex, but you don't want to be, so you want to be simple but formal at the same time. So I'm going to show some of the words, and I know having that sweet balance is sometimes hard, but I think that should be your goal to be as simple as possible, but still professional and formal. Okay, so let me go to the information about your middle paragraphs and how to organize and how to talk about them. So we recommend you to talk about several experiences in general. Tell them what you learned, and then give examples, right? It is very different to start a paragraph with, I remember this woman in the hospice when I was volunteering. That is a very specific thing, right? And then you can talk about how the doctors approach the case or how the nurses, depending on the topic you want to touch on. The point is that if you start with that, that is very specific. What we would like you to do, what we recommend to do, is to have a series of experiences talking about something. Like let's talk about the research. So you have different research experiences, right? You have your undergrad, you have a summer, and you have your postgrad. All these three research experiences. So do you start with one specific project? We don't recommend that. We recommend that you put like a big picture of the things you have learned through several research experiences, right? Like I don't know, like how you develop different skills from the beginning through your research experience at this place, and then at this place, how that is likely changed or evolved, and then I learned this, and then I learned more things. For example, and when you said for example, then we go to the specific things we are talking about here. So you start broad, you give your example, and then you finish broad again. Like all these experiences may be applicable here and there, right? So wide specific wide is what we recommend in general. Again, this is not the only way to do it. Some people use the what, so what, then what format. So what you did, so what, why is this important, and then what, how are you going to apply it, why this is relevant, right? That's another way to do it. In general, we recommend you to avoid what we call the lecturing style. Many times you want to tell your admission what medicine is all about, or you want to tell them the best way to treat patients, what doctors should do. And for some of them, that may feel a little bit like, you're lecturing me, you're patronizing me. So what we recommend is that you always use your experience to explain this aspect that you consider important. And it just sounds so different when you said, I observed that when doctors do this and that, the outcome is better from the doctors you shadow, right? So this is not lecturing them about what doctors should do. It's about, through your experience, how you observe that that approach was very successful, right? So when shadowing this doctor, I realized that a good way to approach patients was this and that. So if you change that slightly, the perception is very different. Okay? So in general, from middle paragraphs, for all the paragraphs, but especially for middle paragraphs, to be direct from the beginning, again, put emphasis through proportion, give examples, avoid metaphors and interpretations, don't use very sophisticated unknown words, usually when you use thesaurus, and try to tie sentences and paragraphs together. So we have a couple of slides after this one that I'm not going to read, but there are some words we recommend you to try to avoid, like but, however, contrast, emphasis, and concession. And I think I had another one. Let me check if I don't have it. I'll include it here about useful words. For sure, you want to use active voice, right? You don't want to use passive voice. And I'm going to show you some examples. You want to use strong verbs. You want to be direct, right? Tell what you learn from the experience. So I have a couple of examples here. Sorry, let me go back. I was able to shadow. My research was conducted. I thought, and thank you, Dr. Kristen Zukoski, she helped me with these the slides, and I think this is very helpful to see how different it sounds to say the same information in passive voice than saying, I shadowed this doctor, I conducted these experiments. These experiences taught me this and that. Dr. X treated the patient. Don't go around with the idea. Be direct and don't use passive voice. Okay? Eliminate unnecessary words. I'm going to give an example here. I'm not going to read because I want to have some time for questions, but you're going to have that in your slides. Okay? And try to connect the dots and make it flow. And I know that is sometimes challenging, but if you use transition words, if you use what you learn, if you use your whys first, right? I learned this and that, but I wanted to learn more. And then in your next paragraph, when I went ahead and exploring this place, I learned more and more, whatever. So connecting the story. And then sometimes it works when you have a beginning and then that ties with the conclusion. I don't feel like this has to be the rule that you need to do this, but sometimes it works out really well. For your final paragraph, we recommend a strong statement that summarizes your experiences and emphasizes the skills and strengths that you have, that you are showing, and that will make you a strong candidate. You can also include other things like your vision, like how you are planning to contribute to the field, etc. Okay, so I had this slide because I have this question a lot. Can I again mention my significant experiences? I already answered that. And then the final thing that I think I already mentioned, but I like to mention again. Ask someone else or yourself or both to read the statement and see if you just remove the first and last paragraph when you said I am interested in medical school, right? If you remove that, if that statement is clearly saying you are interested in medical school. And if it is not, there is something wrong there, right? If you could submit this statement to nursing school or to social work or to other things unrelated, there is something wrong. It has to be very clear. Okay? All right. So some recommendations like this book, The Elements of Style. Other resources that I love Grammarly, as you already noticed, I have a very strong accent. English is not my first language, and Grammarly, I just love it because sometimes I just use so many words, and when I see what Grammarly is doing for me, many times I really like the second version, the version they suggest. But there are other ones here that people have recommended. You can explore and see what is a good fit for you for checking grammar and proofreading. Okay, remember, we don't want typos. Dr. Franklin this morning mentioned several times, if there is something I hate, is typos in the application and obviously the personal statement. All right, MD PhD essay. I promised I was gonna use 1 hour, but yeah, it looks like it's a little bit more challenging when it's virtual and we take more time. Hopefully you're still with me, okay? Okay, before going to MD PhD, any questions? More questions about like the general personal statement?
So there's one question just asking if you can re-explain the first wide in your hourglass model.
If I can re-explain why, sorry? Oh, the first why I am reading this. Yes. So the first why means that you don't conclude a learning from one experience. You start explaining what you learned from different experiences. And that's the why. Let me just go back to the slide. So the why would be telling them the general learning lesson, the general skills you developed, and then giving an example. What I have seen sometimes is that people start saying, I remember when a doctor talked to this patient so calmly, so slowly, even that the prognosis was so bad. And I realized the importance of speaking like that. So hopefully the conclusion you are making here doesn't come from only one experience. Maybe you want to say the importance of speaking in some way or taking into consideration cultural backgrounds or taking into consideration other things that you observe through many experiences, shadowing different doctors, and then saying, for example, I remember the case, right? So deducing, concluding from more than one experience, from wide number of experiences, and then give an example instead of doing the other way around. I hope that answers the question. And then the general way you want to apply that approach. Why the specific why?
Two more excellent questions just came in. One,
Sure.
who do you recommend is the best person to read our essay to give critical feedback? Friend, PI, parent, stranger?
Okay, that's a very good question. So give me the list again.
Friend, PI, parent,
Yeah.
stranger?
Okay, so stranger is always good because they need to know if you are conveying the message without knowing you. So hopefully stranger is also advisor, right? Which additional to be a stranger also has experience reading essays. Advisors, we advisors read hundreds of essays every year. And we have conversations among advisors and with admissions too. So I would say, I would add that characteristic to the stranger, to be a stranger and someone with experience, right? I'm going to give a couple of resources for advisors. If you are at NIH, we are 4 advisors in the office. If you are outside NIH, you may have an advisor in your undergrad institution or your institution. And if you don't have an advisor, there is a website where you can get someone helping you for free through the National Association of Pre-Health Advisors, which I love. Is an association that is very supportive in many aspects, and you can have that support from there. So that would be my number one, right? But you also may ask a friend, a peer, with the caveat that they don't have the experience, but they can give you some feedback, right? Parents will always love you and will may not be very objective. So that I'm not sure about that option. Some of your parents have a lot of experience. I asked my son to give me their essays. So yes, why not? But you also always need to put that factor, right? Uh, they know me better. Uh, am I conveying the message enough? Because this person already know me. Your PI may be a good one. I would say make sure that you know that you always ask why the changes, right? So if you tell me, but Elena, why you are suggesting to emphasize the clinical aspect, I can tell you, well, you know what? I am hearing day after day this essay, or I'm gonna tell you something that I heard among admissions. They said half of my essay, my personal statement essays, go to the social worker folder because they are not emphasizing unique clinical aspects, unique doctors' roles that they have learned from in the statements, right? So if you ask me why, I'm gonna tell you why. When you have these PIs reviews, ask them, why do you think I need to change this? Why do you need I need a hook? I have heard this from PIs. You need to put something that catch their attention. And from the on the other side, admissions are telling me, please advise your students, no hooks. I don't like hooks, right? So it is important to know the whys and try to, I would say, ask more than a PI. And if you can get at least one advisor to read it, I would recommend that. Okay, and what was the second question?
Thank you, Elena. And the other one is about COVID. So if you should include any things that got canceled due to COVID, and how much emphasis on COVID and what we've learned done during this time do you think should be in a personal statement?
That's a very good question. So I would say you really need to reflect on how this situation has influenced you to make this decision and what you have done for the community, for learning more, for being creative to get the experience you may need. I think that if I read an essay about COVID thing, and I read them last year actually, about it was so challenging to shadow due to the situation, and it was so hard to get the exposure, and you don't go anywhere else after that, I think that is not helpful. But if you tell me, oh my gosh, this situation really woke me up, that there are so many health disparities, there are so many things we can do. I started making masks because and educating people because a lot of this problem has been education, right? So I started doing this and that, and this has been very fulfilling. And I also learned to respect other people's opinions, but at the same time educate and um, make an impact on this society, intervening in this way, right? That's a very different approach than the first one, which was only complaining that couldn't get the grades that she wanted to, uh, I don't know, to increase the GPA or to have more exposure than the other person that says, I uh, am concerned about what we are living in. I am contributing this way with my community. I am helping in this way. And that really made me learn more and think more about these health related aspects of medicine. So it depends, right? I would say don't use it just to complain or to justify that you don't have whatever, the clinical exposure, the shadowing hours, etc. And if you did something for your community, please include it there. I think that would be helpful and would show the kind of person you are. Okay? All right. Then let's go ahead with the MD PhD essay. So when you explain your research, that's probably the easiest part. You need to always mention how this research is helpful to advance medicine, your interest in knowing and learning and understanding mechanisms of this particular disease, right? The most challenging thing I have seen people talking about is why they need medicine for the research. This say is not about explaining in one paragraph why medicine and another one why the PhD. You already explained why medicine in your personal statement essay. This one is the integration of both, right? So one of the questions you need to answer is why you need medicine for your research. You know that according to the outcome study released by the published by the AAMC and according to the experience, people, physicians, scientists will dedicate most of their time to the research. So it will be important to highlight how this medical background and this interaction with patients is going to be relevant for your research, for the design of your research, for the progress of your research, from the perspective you take. So it is important to highlight this. If you have shadow at the clinical center or the physician scientist, try to identify how they use the medical knowledge to design the research. I have put several examples in other workshops about why, as a physician scientist, you are going to use, let's say that you work with neurological disorders. So, how important is for you to know the anatomy and the physiology of the brain, how this is connected with other systems in general, not only the brain, the whole nervous system, how this is connected with other systems, how when you are studying a drug for a neurological disorder, you also need to know about metabolism, about how this drug, goes to the liver and how what is the active metabolite and things like that. So the medical knowledge may be very important for the kind of research you want. You may want to do basic research as a physician scientist also. Um, Having this background is still very important. I don't know if you have seen at the NIH or in other places people doing basic research, studying a very specific things, and they only talk about that micro world. You need to go bigger scope and put the relevance and the importance of knowing that specific tissue, that specific organ, and also the relation of this organ to other organs. So for that, the medical knowledge is going to be very important. Um, you may want to be the person who implements this research directly in your patient. So you want to see your discoveries in the clinic, and that is also a personal interest. So you may want to also express why you want to be the person implementing these discoveries. You may also talk about how seeing patients, you identify the relevant questions, right? It is indeed different to read it from a paper than seeing in your patients. Now, I'm not saying we don't need researchers, right? Without an MD, of course we need them. Their interests may be different. If you want an MD PhD, if you want to be a physician scientist, you may want to explain how important and relevant for you is to see the patient to identify these questions you want to answer doing your research. And the final thing that is not always easy to do to have, but sometimes you have, once you implement your research, you can see the results in your patients, you can have feedback from them, you can analyze what happened, you can go back and redesign your research, right? So all these aspects are important. All of them are integrating the research and the medical aspect. Don't separate them. It's better to explain them in a combined way. For the research essay, you have plenty of characters. Make sure to specify your supervisor's name. You talk about the affiliation, the duration of the experience, the question, the contributions, right? Try to expand on the most relevant ones. Some of you have 5 research experiences and you started in high school. You don't need to use the same space, the same room for everyone, right? You again need to emphasize by proportion. So you may mention the first three ones as the ones where you got, basic knowledge about, I don't know, basic techniques, or just, to learn how the scientific method works. And you be very brief and you go to the most relevant ones and expand on those. Always start with the big picture. It's always, whatever your project is, it's important to have that vision, right? That perspective. You are going to be a physician scientist, right? So talk about the big picture, talk about the objectives and achievements. And it is important to mention, especially when you use very sophisticated techniques, I think it is important to mention how you answer those questions through these techniques, but your techniques are going to be the means to answer that question, right? Your goal is not to master the techniques. You are not going to be a technician. So just be careful how to explain the techniques and be clear about being the means to answer your scientific question. And obviously, always mention the clinical application if it's in a short term or in a long term. That's very specific. Usually, I don't have many issues with the significant research experiences set. For DOSAs, I have to say it could be very similar to MD. Your motivation, your journey, how you learn about this profession. Hopefully, you have shadow DOs and you can talk about that. Make sure that you emphasize the holistic approach the osteopathic medicine has. If you have witnessed the manipulative medicine, talk about that, talk about the use of your hands and other differences you have observed when you shadow DOs. Okay? Okay, so finally, for the online course or for the people outside, ask for feedback. We already talked about the people who ask for feedback. Put your final draft together before going and together, I mean incorporating the feedback you are convinced with, and then bring your final draft to an advisor, a pre-med advisor. We are gonna give more information for the people who wanna register for the course. Most probably it's gonna be open next Friday, and all the postdocs at NIH will receive an email with all the information. Most probably it's gonna say pre-meds in the subject, so pay attention to those emails. For people who are not at NIH, you are gonna have a link here that is given by the National Association of Advisors in the Health Professions to locate an advisor in your institution. And if you don't have an advisor, you have an option to ask for help, support through this organization. I had a recording that I was planning to play here. I think I'm gonna just probably play the first 2 minutes and then I'll stop it. And this is from Dr. Quesada from the University of Maryland. I'm gonna play it for the first 2 minutes and then I'm gonna go ahead for the next couple of slides I have for you. Let me see if I can do that. Maybe I cannot. So if that is the case, you know what? I'm gonna link this presentation to the audios. So you're gonna have that in your slides today. And if I can incorporate more audios, please do it by yourself. It's not working today. All right. So all this process is stressful. Just remember to take care of yourself in all the important aspects. Yes, we need to take care of ourselves during these times. Medical school application is straightforward, but it's a lot of work. So you need to make sure that you also pay attention to yourself. So I have some links here from the NIH, wellness events coming up, affinity groups that are now open to all, SAGNAT for Hispanic and Native Americans, the NAF group for African Americans, Fellows and Friends, LGBTQ Fellows and Friends, more dogs, Fellows with all abilities, etc. Please find your community to support you. If you are at NIH and you need urgent help, you can always call the NIH Employee Assistance Program. And I'm sure in other institutions you have other resources for urgent help. All right, so finally, my last slide here. So thank you for the 128 that are still here. Thank you for your patience. I hope this was helpful. I am going to stay here for questions. If you have questions and you want me to answer, I'm going to stay here for some other extra minutes. I'm happy to answer more questions. Do you see anything there, Kristen?
Yeah, some very good questions. What if you're interested in doing research with an MD, not an MD PhD? How might this be reflected in your personal statement?
Sorry, I didn't hear you the very beginning. Can you just say that again?
What if you are interested in doing research with an MD, but not an MD PhD? How might this be reflected in your personal statement?
Oh, I see. That is okay. There are some options, right? For people who don't want an MD PhD, but they want still to have the research incorporated. So I think expressing that in your personal statement is fine, as long as you don't give more emphasis to the research than to the clinical aspect of this career, right? I think the way I see medicine is, you're going to be a physician seeing patients, trying to improve your patient's health, and you are going to use different resources. Let me put my camera. You are going to use different resources to achieve this goal, right? You want to achieve, you want to improve this patient's health, and you want to incorporate research. You want to be part of the discovery too. That is totally fine, as long as you don't talk about research much more than the clinical aspect. But I think that's a positive thing to include.
So very similar. If we are considering an MD, MPH, should we mention that and our motivations for that in the personal statement?
I would say yes, but also it depends on if you are applying to only MD, MPH programs or MD only. And the same happens for MD, PhD, and MD programs, right? Remember, your personal statement is just one. So if in your personal statement you say you're going to be, you want to be a physician scientist, and then you said, well, but just in case I'm going to apply to some MD programs too, that information is in there. It's for both. So you need to make sure that it's general enough that it responds to why you want to be a physician in the personal statement if you are applying to both programs, to two programs. Does that make sense?
For the significant research essay, do you need to knit your research experience into a coherent story like the personal statement?
No, that is different. You can be much more, straightforward. Sometimes it is easy to make a story there when you have, like, let me just put an example. You started interested in the nervous system, so you started working with Alzheimer's patients, and you were interested in these histological um, findings, but then you realized that there was a way to actually measure things, and you started incorporating the computational skills, and then blah blah blah. So that could be a story, right? Very technical story, but that could, step one is the introduction to the step number two and number three, and I think that's totally great. But if not, that's totally fine too. I studied, fungus in my first research experience. This is what I learned. And then in my second one, I work with zebrafish, right? Or in cancer biology or whatever. So it doesn't necessarily need to be a story.
Should we address academic stuff in the personal statement, GPA, specific grades, class assignments?
When there is something that it's important for your admissions to know, yes. So I have had different cases where, one of the parents died in second year, and it was a clear boom, right? Decrease in grades, and then starting going up again. You can be as specific as you want. You can say I had a personal issue. You can say someone very close to me died. You can say my parent or my father or whoever. And then I think it's important for them to know that there was a powerful reason why you have that performance in that particular semester or that particular year. I have other students that have been diagnosed with disabilities at some point, most of them during college. So they have certain performance before and then they are diagnosed and treated, or they receive accommodations, and then, oof, big change, right? So it is important to explain, oh, this is what happened. That's why I was having this. Some of you have other kind of issues. I was coming from a very small, not challenging school. First semester was super hard. I had to learn so many things. I had to relearn how to study, right? So you can mention that briefly, and that's why that first semester was so hard and your grades were not great. But then you learn how to study, that then you learn how to learn, right? And then you had this other performance. So you need to feel comfortable sharing that. I have seen that it is helpful for your admissions to know if there were particular reasons why that happened. Those grades were not great. All right, more questions?
For the MD PhD essay, can you use the same experiences that you used in the personal statement and the research essay, but with different examples?
Yes, you can. For the research essay, you said, or for the
MD PhD essay.
MD PhD? Yes, yes, you can, and again, may be expected. For some of you, this is gonna look like repetitive, but most probably the same experiences have been very important for you. So please use other examples, use other ways, other words to express sometimes the same ideas.
A student who did a year of research that was in health sciences that was unrelated to, environmental sciences that was unrelated to health, and advice on how to incorporate that.
I think there is always good things you learn during research experiences, right? You develop your critical thinking, your analytical skills, sometimes your communication skills. So I would say don't expand on that too much, but let them know that you started developing skills in that experience. I think that is useful. I've heard some people saying, well, if the experience is too brief, if that's not related to medicine, you may skip it into research essay. I have heard people saying, please include everything you have done. Just mention that briefly and expand on the most important ones. I'm more inclined to follow the second advice because I think that it is important to show everything you have done. And I am sure you develop skills during that research experience, right? Research is scientific method and you learn a lot of things.
And if a drop in GPA was due to, quote, loss of vision motivation, which was then regained with the decision to pursue medicine, would that be okay to include?
I would like you to have this conversation with your advisor because when you lose motivation, there are usually underlying reasons. And I wouldn't like you just to say, well, I lost motivation without explaining better if you are comfortable with that. Right? We know that you were not lazy, right? And laziness is something that we can talk about for an hour and try to explain the reasons why, right? Is really laziness or is all these different factors that are uh, playing a role in that decision of not going to this place or not having that motivation. So I think just saying I lost motivation may be too vague. Maybe you want to explore that a little bit further.
The question that just came in is, I talked heavily in my first draft emphasizing being a physician scientist, not just a physician, but I'm only going to apply to MD. Should I still make sure to focus on clinical and patient contact experience over my motivation for translational research?
You said you are applying to MD programs, right?
Yes.
Yes. Okay.
Yeah, I mean, the other
Start?
ones, I think, Elena, just like you said, if you have specific questions or specific things related to you, we really do recommend that you reach out to a pre-medical advisor. If you're at the NIH, that would be one of us. And if you don't have one, then that's using the links Elena shared. Also, Elena, someone posted that the audio is not working in the handout link that you posted. So I don't know if there's another way we can get Dr. Quesada's.
Thank you. Thank you for letting me that. Then let me see how we can do it. We have a younger person, much more savvy in technology. So I'm going to ask him to help me to put the links, the right links there. But I think it's just powerful to hear from admissions. So yes. So for people at the NIH, we're going to have bi-weekly sessions, drop-in sessions for questions. Please attend. The next one is going to be next week, Fridays at 11. Just come and bring your questions. Sometimes people don't have questions, but they want to hear other people's questions. So you are very welcome to attend. And if you have questions about the personal statement too, we can discuss that. All right. Sounds good. Thank you very much for being here. It's been a very long workshop, but I hope that was helpful. Nice to see you all. Thank you. I've seen some familiar names. Mika, Stephanie, Adela, and other familiar names. So nice to see you guys here, and I hope to see you in our next drop-in session. Bye.
Bye.
Thank you, Kristen. Bye.